This is a question I was screaming a couple of days ago that I posted a video about, and that it's the reason why I'm so emotional, because I'm seeing gaps and holes in her treatment that are coming to light. And I was calling this out a couple of days ago and saying, please, I cannot find it. Can anyone show me if there was any blood work done on her in the entirety of her time being treated and seen postpartum, for those 8 months postpartum, that for the times that she was going in, was anything done, or was she just given medication treatments and suggested diagnoses? What I am finding and what I am hearing is that it seems like not even the most basic blood work was done. So let's talk about it. As a mental health clinician, I reference this in looking. This is the DSM. They reference this in the trial. This is the Diagnostic and Statistical Manual of Mental Disorders. I don't have the most recent one. I am not currently working as a mental health clinician. I am a stay-at-home mom, okay? But I'm breaking this down and telling you that this is what diagnosticians, clinicians, psychiatrists, psychologists use to diagnose clinical mental health disorders. So let's just talk about the one that I reference the most on this page, which is PMDD. When you go to diagnose someone, you are looking at a set of criteria that they must meet in order to be given that diagnosis. Then, if they meet that diagnosis, we have a section here that helps us to rule out, do a medical rule out, do a rule out of environmental factors, etc., to see if there's any possible reason why they're presenting with these symptoms and why they have this presentation, anxiety, rage, depression, whatever it may be, in the 2 weeks before their period. So this is just one diagnosis, but this is the precedent, that the standard of care, that we should do a medical rule out or a differential diagnosis. Let me read to you what is supposed to be done when we are talking about clinical mental health practice. What is the ethical, responsible thing to do? I am hearing from emergency, room nurses that treat psychiatric patients that they never do blood work on psych patients. I'm understanding that. However, standard of care, standard of practice, which it seems like Lindsay did not get, is to rule out. So let's listen to this. The symptoms, meaning the symptoms that present of PMDD. So decreased interest in usual activities, marked irritability or anger, marked depressed mood, marked anxiety or tension or feelings of being keyed up or on edge, marked affective lability, mood swings, feeling suddenly sad or tearful. We need to rule out that those symptoms are not attributable to the physiological effects of a substance, example, a drug of abuse, a medication, or another treatment. So we need to rule out that there's nothing being taken. And they did say they did a tox screen. It seems like they did that when she was admitted for psych care. But there are also many of the medications that she was on that, from their manufacturers themselves, say that they have side effects that would be aligned with the side effects that she was talking about, the symptoms that she was talking about. I did not see a medical rule out done on them. I digress. The next thing that we need to rule out for is another medical condition. For PMDD specifically, in parentheses, we have example. I don't know if you can see that. It's going to be cut off. Okay, look at this. Hyperthyroidism. That is just one possible thing that we need to rule out for. Therefore, which is another thing that Lindsay's psychiatrist that gave testimony today said, that she thought to diagnose her with bipolar disorder. I'm not phrasing it the appropriate way, but she thought a bipolar disorder diagnosis fit the symptoms that were presenting. And Lindsay did not want to be diagnosed with bipolar disorder. That's a whole other thing for a whole other day. Bipolar disorder, if you have been to my page and been listening to me, is one of the most commonly misdiagnosed things for women that have PMDD, hormonal dysfunction, luteal phase issues, thyroid issues that follow a cyclical nature, especially rapid cycling BPD2. It can be a common misdiagnosis. So that means that women, when they should be given a PMDD diagnosis, are often given a bipolar diagnosis. But if they thought that Lindsay had BPD, then a responsible clinician would have said, I need to make sure I rule out for any possible medical causation. A responsible clinician also would have understood the cyclical nature of those symptoms if Lindsay gave them adequate information, which is hard to build on. They didn't even have information from the 3 doctors or physicians or providers that she saw before. It seems like they didn't even know that she had called the hotline 2 times prior to, So we're operating here on a broken system that doesn't have proper communication, that doesn't have proper continuity of care and treatment, that doesn't share information equally, that isn't accessible, and it affects the patient that's in the middle of all of that. And it relies on the patient who is sick to make sure, and the psychiatrist said this today, to make sure that she tells them all the medications that she's on and that she's taking, rather than look at the record of what's been prescribed to her and what she should be taking. They are taking her word for it, the woman that is in there for psychiatric concerns. I'm not saying don't trust women, but I'm saying let's have a system that actually backs that up. So we need to rule out for any medical condition. And in PMDD, they need to rule out just one example for hyperthyroidism. How do you rule out for hyperthyroidism without doing a full thyroid panel? How do you rule out for other medical conditions without doing blood work, without actually seeing and getting a deep, comprehensive medical evaluation? In my opinion, you cannot. And standard of care says that you should be doing this when you are going through diagnostic criteria or looking at a patient on the other end who may receive a diagnosis. And then rather than doing all of that, we are putting her on medications. Now, some of the choices that they made make a lot of sense. I'm not putting down psychiatric med care or medications. It is important that you give treatment while also, because you don't want to leave the patient high and dry, while also making sure that we evaluate other possible causation, other possible contributing factors. And that was not done. And now that I'm calmer and more rational, I can finally talk about this in a way that I'm not sobbing, because I think that this was a clear-cut failure of a woman who had so many red flags that ultimately ended up taking the lives of 3 innocent babies that were her own, which by all accounts we have seen that she actually loved them and would never have wanted to do that in her right mind, although that's what this case is trying to prove. So before I get emotional again and frustrated and angry and start crying on the internet again, I'm going to leave you with that.